Thank you so much for your time. I'm Dr. Brujo Teen. I work at Women and Infants Hospital, and I'm here on behalf of ACOG, the American College of Obstetricians and Gynecologists, to oppose several of the bills. I wanted to start with the Senate Bill 2137. So with this Senate bill, it's stating that as providers, we must ensure that all reasonable steps are taken to enable a fetus carried by their patient to be brought to term. This bill would essentially criminalize all obstetricians, family medicine physicians, nurse midwives, or any other healthcare professional who routinely deliver women prior to term for various conditions. In many cases, this restriction will jeopardize a woman's and a fetus's life. Preterm birth refers to a delivery before 37 weeks gestation. The cause of preterm birth is vast. 70 to 80% being spontaneous due to preterm labor or early breaking of water. The remaining 20 to 30% are due to maternal or fetal issues that endanger the health of the mother, the fetus, or both. For example, in the last couple of weeks, I took care of a patient who came in at 29 weeks gestational age. She was diagnosed with something called severe preeclampsia. With that condition, you develop severe elevated blood pressures and then ultimately have end organ damage. The condition not only has effects for the mom, but it affects the fetus too. It results in fetal growth restriction, deprivation of oxygenation. So we tried our best to control this patient's blood pressures. However, her disease progressed and she became clinically unstable. And at this point, the only safe thing to do for this patient and the fetus is actually to induce labor. The provisions in this bill would make it unlawful for her obstetricians to deliver her prior to 37 weeks. It is without a doubt, if this patient's pregnancy were carried to term, there would be grave effects for her and the fetus, and likely would result in death for both. This is just one of the many examples in obstetrical care where we deliver early to save not only the woman's life, but also the fetus's life. By signing this bill, we would place physicians in an unacceptable position of having to deny a woman the evidence-based, compassionate care that actually results in the fewest complications. It is extremely dangerous for a legislator to presume that they are better equipped than an experienced physician to judge what treatment approach is appropriate for a patient and under what circumstances. What we are actually doing with this bill is directly harming patients. So I urge you to reject Senate Bill 2137. Just a couple notes on the other bills that ACOG is also in opposition of, Bill 2142 and 2152. I think first and foremost, it is imperative to clarify that it has always been the law that healthcare providers cannot deliberately harm newborn infants, and that we must exercise reasonable care in the treatment of infants. The implications of this bill states that providers who perform abortions somehow act in a callous and criminal way and cannot be trusted to take adequate measures to save an infant's life. To the profession of medicine, this is both insulting and untrue. By opposing this bill, I do not oppose the appropriate medical care for an infant. However, I do oppose politicians dictating the parameters of what is appropriate care and establishing those parameters through ambiguous language and lack of medical knowledge. The language that I'm specifically focusing on is what is the definition of viability in these bills? Where does gestational age play into these bills? Because one of the bills states, regardless of gestational age, but gestational age is actually the thing that directly plays into outcomes for neonatal outcomes. And it does not address what steps should be taken for infants who are delivered before viability. So when you define viability as the capacity to sustain survival outside of the uterus, when a pregnancy delivers before viability, let's say that's through natural or induced labor, there is no medical intervention that can save the life of that extremely premature infant. For example, we know from data that if infants are born less than 23 weeks, that less than 5% of those infants survive. And then you take those 5% that do survive and you follow them out, and close to 98 to 100% of those infants have massive cognitive morbidities. With these bills, I think what we are doing is belittling the complexity of situations where infants are born prematurely and excluding the intimate conversations that take place between the patient and provider. We have to look at these bills critically and see that they do not actually enhance protections or improve the quality of health care. What these bills do is interfere with a doctor's medical judgment, knowledge, and skills to provide the best, and I think most importantly, the appropriate care for the patient. So I urge you to oppose bills 2142 and 2152. And then lastly, I'm also here in opposition of Bill 2791. This is, again, the bill that talks about if you aid a minor across state lines that you would be considered a criminal for doing that. I think it's important to consider this bill as, in an ideal world, if a woman were to get pregnant, yes, she would have a positive and a close relationship with her parents, and she could go to them in that crisis and figure out what would be the next best step. But we don't live in a perfect world. While providers do encourage their patients to seek support from their families, some adolescents may have legitimate fears that they will be physically abused or ejected from their homes if their parents found out they were pregnant. Among minors who did not tell their parents of their abortion, 30% had experienced or feared violence in their family. I think we already in the state of Rhode Island have one of the strictest parental involvement laws in the country. The American Medical Association, the Pediatric Association do not endorse parental consent for abortion procedures, stating that mandating parental involvement does not achieve the intended benefit of promoting family communication, but what it does do is increase the risk of harm to the adolescent by delaying the access of appropriate medical care. With this bill, what you would say is it's a felon for any person, including a grandmother, an aunt, an older sibling, a provider, to assist or even encourage a minor to travel out of state because she believes she cannot obtain parental consent or a court order. I think it would send a really harsh message to minors for facing unintended pregnancies that they cannot turn to the responsible adults. It would prevent them from having honest conversations with their healthcare providers. I think ultimately what it will do is will delay care. And we know that that is not correct and that's not okay. It also may force minors to turn to illegal methods for pregnancy termination, which can also have really bad complications for those minors. So again, on behalf of ACOG, I urge you to oppose this bill.
Thank you. Senator Lombardi.
Doctor, I want to get back to 2137 a minute.
Sure.
And perhaps it's a better question for Lynette, who I know is here. But I'm curious, is it your position that the doctor faced with that dilemma, the 23-week-old fetus, where the mother's condition is at risk, is not acting reasonably if she terminates that pregnancy?
I'm sorry, could you?
So what I'm saying is that Senator Chacón's bill at page 2 basically prohibits failing to ensure that all reasonable steps are taken to enable the viable fetus carried by their patient to be brought to term. And I would submit to you, at least it's my opinion, that in that case, the doctor would be acting reasonably if it meant the life of the mother in that case.
Right. I think the issue with the bill is the terminology term. And I think when you put that into context, there are so many conditions in obstetrical care where you deliver prior to term. And I think that's the issue. If you clarify further into that, then the broad language term, that is whole, 40 weeks plus of obstetrical care where things can happen, where you can deliver prior to that point.
Doctor, is it fair to say that your concern with the language is that you can deliver a healthy baby prior to term? So it's just the language that's used, not necessarily the fact that you're going to look to do something other than deliver a healthy baby, but you don't want to be pigeonholed into that, carrying it to term.
Yes.
If there's something you can do safely to deliver the child.
Exactly. I think that language has to be altered.
Senator Lombardi.
And secondly, Doctor,
Sure.
I noticed that you didn't comment on the Dismemberment Abortion Act or the partial birth abortion. Is your body taking a position on either one of those?
So we actually have another physician here who will talk about that.